Good afternoon, everyone, and welcome to our Lunch and Learn webinar, Improving Breast Screening Rates in Your Practice. My name is Ruby Van Kool. I am the Cancer Prevention and Control Program Officer with Central and Eastern Sydney PHN. Also with us from CESPHN is Linda Silva, the Digital Health and QI Program Officer. I would like to start by acknowledging the traditional custodians and sovereign people of the lands across which we work. I acknowledge their continuing connection to land, water and community, and pay respects to elders past, present and emerging. I would also like to extend that respect to any Aboriginal colleagues who may be joining us today. Just some housekeeping. Please note that this webinar will be recorded and available on the CESPHN YouTube channel within the next couple of days. Please submit your questions via the Q&A function throughout the presentation. To view this box, hover over the toolbar at the bottom of your screen. At the end, an evaluation will pop up. We would appreciate your feedback and please complete this so that we can issue certificates of attendance. For the GPs in the audience, this will be automatically recorded as 1 EA. So, our goal for today is for you to leave with actionable tasks to apply in your practice. We'll cover identifying patients due for screening, QI strategies and resources, overcoming barriers to screening, and implementing reminder systems. So breast cancer is the most common cancer diagnosed in females in New South Wales. 1 in 7 women in New South Wales will be diagnosed with breast cancer in their lifetime. Regular breast screens can find cancers that are too small to feel or see. Treatment is often less invasive, and the likelihood of a full recovery is significantly higher when detected early. Despite the importance of early detection, only 50% of eligible women in the CESPHN region are up to date with their screening. Canterbury, Bankstown, Woollahra, and Strathfield LGAs have the lowest screening rates in the region. Screening for Aboriginal and CALD communities is also below 50%. These statistics highlight the need for targeted interventions. So the role of primary care. Primary care are in a unique position to influence patient decisions. Research shows that women are more likely to attend a breast screening appointment when encouraged by their GP. A simple conversation during a routine appointment with a GP or nurse could be what encourages women to take action. Primary care staff also play a key role in driving quality improvement. By implementing data management processes, educating women on the importance of screening, and reminding eligible patients, general practice can directly contribute to higher screening rates and improved health outcomes. While a GP referral is not required, Breastscreen New South Wales do have request pads available. These can be used to encourage eligible patients to book an appointment. GPs are also crucial in ensuring that patients follow up with any further assessments and treatment as required. So there are several common concerns that patients may have regarding breast screening, and understanding these can help you address them with patients. It can be helpful to reassure patients that all radiographers at Breastscreen New South Wales are female and that screening takes place in a private room. Women can also speak to Breastscreen if they would like to bring their own shawl for modesty. Inform patients that while some discomfort is normal, the process is over fairly quickly. 2 images will be taken of each breast, each lasting around 10 to 15 seconds. They can also ask to stop the procedure at any time. Reassure patients that the radiation from a breast screen is minimal and closely monitored for safety. The benefits of screening outweigh the risk of exposure. Women may feel anxious about the screening process. It's helpful to explain that the appointment is quick, lasting around 20 minutes. The Breastscreen New South Wales website has resources and videos available for patients outlining this process. Screening rates differ significantly, with some populations facing additional barriers to screening. By understanding and supporting the unique needs of priority populations, primary care can play a key role in improving screening uptake and also ensuring equitable access to screening services. Cultural sensitivity and building trust are key for engaging Aboriginal and Torres Strait Islander people. There are tailored resources available online to support you in promoting cancer screening and prevention. Language barriers can often prevent participation for people from multicultural communities. Breastscreen New South Wales has resources available in 27 different languages. Providing these to patients can improve their understanding of the screening process. Appointments can also be made through the translating and interpreting service. Breastscreen New South Wales encourage patients and carers to contact them to discuss any individual support needs. All Breastscreen New South Wales services are wheelchair accessible. Screening can be done while seated in a wheelchair if the arms of the wheelchair can be removed or lowered. Guide and assistant dogs are always welcome. If required, Breastscreen can arrange to have an Auslan interpreter attend an appointment. Breastscreen New South Wales is committed to ensuring that its services are inclusive and accessible. More information can be found on the Breastscreen website about screening recommendations for trans and gender diverse people. It is important to accurately record a person's gender in your clinical software to ensure people who should be screening are receiving appropriate reminders. Also, just to note that Breastscreen New South Wales also offer group bookings. Women may be more comfortable attending with a family member or friend. There are some practical steps that you can implement to improve screening participation at your practice. Begin by cleaning your practice data. This involves removing duplicates, updating patient records, and marking ineligible patients appropriately. Assess current breast screening rates using a clinical audit tool. Identify gaps in your patient population, such as under-screened or never screened groups, and understand people who may require some additional focus. Engage with patients through education and practice promotion. Address common concerns and tailor communication, including displaying posters and having resources available, particularly for priority populations. Remind eligible women to book a breast screening appointment. This can include opportunistically reminding women when they attend the practice for another reason. And finally, review progress and outcomes, such as screening uptake and patient feedback. Adjust strategies as needed to address any gaps or barriers. The activities we are running through today are all part of quality improvement in general practice. By embracing QI and refining processes, you can ensure improved patient outcomes and overall practice performance. I will now hand over to Linda Silva for a practical demonstration.
Thank you, Ruby. I will share my screen. I will start with CAT4 and then move on to Polar. Both of these tools are provided by Central and Eastern Sydney PHN to accredited practices that participate in the PIP-QI program. If you are a non-accredited practice interested in undertaking quality improvement activities, you can also approach us for a license. I will share my screen now and start with CAT4. Yep. So hopefully you can all see my CAT4 audit tool. So I'm on the landing page. I have my filters open. I will start, the starting point is selecting the age filter 50 to 74. I have my active filter selected. I will recalculate and close my filters. I'm on the screening report page on the mammogram. and I can assess my current benchmark. My starting point for my sample practice is this segment here. So 24.1% of my screening population have a current mammogram result recorded in the clinical system. But I will focus on the cohort that shows as never screened, which is the black segment here. I can see that it contains 712 patients. If I would like to identify these patients, I've selected this segment and I go to export. Okay. From here, I have the option to do further cleanup. I can use a refine selection function to cleanse from patients that are no longer attending the practice before I move on. I can also use if I have a CAT4 function enabled for SMS recalls, I can straight away go from here and do a recall here. Or I can use a top bar prompt. Most CAT4 users use top bar prompts either at the on the admin level or at the clinical level. So we can set alerts for these patients when they present for their booked appointments to also approach breast screening. Another option I have is to export this list to Excel, which will then allow me to do a mail merge or do further filtering, let's say by provider. So if you work at a large practice, you might end up with a long patient list such as mine. So you might consider combining this search with other eligibility searches, such as patients that are who are also overdue for another screening program. So I can move on to the cervical screening tab and combine my list with a cohort that's overdue for cervical screening by selecting the not recorded segment. And then I will use the cross-tabulation function in the report here to combine both. As you can see, I started with 712 patients, and now I have a much more manageable list that we can consider whether we are recalling them for cervical screening, and they will also receive education and recommendation for breast screening. Similarly, you can decide to have a look at MBS eligibility, which is the report here, and combine it with identify patients that also have a chronic disease and are eligible for a care plan. So I can do it here, select care plan 721, MBS item number never claimed, and combine, which yields even a shorter list of patients that can be recalled back to the practice. Okay. Let's look at our underscreened populations from the indigenous population. If I would like to identify patients of Aboriginal and Torres Strait Islander group, I will go back to filters and I will change my filter to 40 to 74. Keep active filter and add ethnicity filter and recalculate. So now here I can identify patients that have never screened. Okay, so all of these guides can be found in the fantastic CAT4 library. You can go to help and CAT recipes and search breast screening, and you will find all the visual guides for the steps that I just showed. I will stop sharing for a moment and switch to Polar and show the Polar users the cancer screening module. This should be loaded now. Okay, great. So your standard list of polar reports, apart from the clinic summary that you are familiar with, contains the QIPC report. It stands for Quality Improvement in Primary Care. And you can find a cancer screening module under Clinical and Cancer Screening. I am already on the breast screening tab. And what it's telling me is my starting point. So going from the right to left, it's telling me that I have 2021 patients eligible for screening. And from those, my current benchmark is 768 that have a current mammogram result recorded. And under screen, the never screened population is divided into the urgent screening cohort, which I can select by clicking on the field. And these patients are selected due to their genetics, personal or family history with breast cancer, as you can see here. So these are the ones that have one or more risk factors. If I want to focus on this group, I've already selected them, so I can go and generate a patient list. So from here, again, I will probably choose to export it to Excel and maybe filter it by clinician and divide it into smaller cohorts that will be approached separately, or I can do a mail merge or my regular reminder process. Going back to the report is done by going through the link. Okay. If I want to look at a different cohort, first I will remove the filter for the urgent screening required. Okay. And now I can select the non-urgent patients that are now due for screening. My selection always appears here, so I can see and track the filters that I work with. Yeah. Okay, so this module is also fantastic for tracking your improvement over time. As you can see, it charts your progress with the uptake of breast screening. But as you can see, both CAT4 and Polar depend on the quality of the data that's in your system. The more data we have recorded in our software, the better and more accurate the data analysis is. One quick tip I can share with Polar is to take advantage of the data mapping resource. It will show you where Polar looks in your clinical software for all this information, such as family history, or patient age, or prescription of contraceptive pill. So if you click on data mapping for this page, it will take you to the cancer screening module data source. So here I can see that, let's say I'm using best practice, and whether breast screening result is recorded would be dependent whether it's in the clinical images. So most of your breast screening results will come electronically and they will automatically be saved in clinical images. If you get a paper result, you will have to enter it manually into investigation reports. For medical director users, both electronic results and also results that are received manually in paper form will have to be manually entered into results. Okay, so this concludes my demonstration. We will go back to the slides. Thank you, Ruby. I will stop sharing now. This project is also a great opportunity to review your current recall and reminder system. The aim is to send reminders to everyone who is eligible for breast screening, because often we only send reminders to patients that are already screening when their results arrive in the inbox. So a good first step might be to look at your reminder setup in your clinical software. And if you notice any free text reminders that have accumulated there over the years, it's advisable to cleanse them first and then decide on a set of codes or labels that you'll be using from now on. Cancer Institute New South Wales recommends having 3 types of labels. There is a resource that we will share with you that goes in detail when and how to use each code. And that way you will be able to reach all your population of your screening age. Also, you might consider whether you are utilizing your clinical software or other platforms to their full potential. There's also Hotdog and other tools that you can send reminders from. Or you might find that you have unused BP comms credit from the time when we were setting up electronic prescribing, or different ways how you can reach your patients. Also, what I mentioned before, CAT4 has SMS recall system or a top bar prompt that you can use for engagement. Okay. A great way to monitor your efforts and monitor the results of your quality improvement activity is to use one of our templates that we will send you after this webinar in our resource pack. So it will guide you through selecting the members of your quality improvement team and assign responsibilities to them. Also, how to select a really effective goal that's achievable within the time frame that you select, and how you're going to measure. So you will be using either CAT4 or Polar, and it's good to check your progress at least every month. And also CAT4 and Polar will allow you to record your initial benchmark. There's also, we've also listed some ideas what you can do, small actionable steps that you can do, and this template is also a great evidence for your quarterly PIP-QI compliance file, or it can be used for accreditation, and GPs that participate in these activities can record this time as CPD points under the measuring outcomes category using the RECGP measuring outcomes tool. Okay. Quality improvement works best when it's approached as a team effort. Like GPs are the clinical champions and sponsors of the project, but practice nurses and management and admin team play a huge role in because they bring the expertise with the systems, with the audit tool. Usually they are the ones that can analyze your data. They are the ones that understand how to run a health awareness campaign and encourage patients to screen. If you practice from a small practice, or you don't have your quality improvement team yet, please reach out to us and outsource our expertise. We can help you with every step of the process and set you up with a bespoke project that's fit for your practice. For further resources, you can head to our website. We have a dedicated page for breast cancer with the resources that we mentioned in this webinar. But you can also go directly to Breast Screen New South Wales for education and brochures and promotional materials that will help you when talking to the patients. Another great RSEGP endorsed clinical resource is iPrevent, which focuses on patients at the high risk of breast cancer by providing them with personalized risk reports and management options. These can be a good conversation starter when discussing the options with the GP. Also, I highly recommend the Cancer Institute of New South Wales Quality Improvement Toolkit. They have one for every national screening program, and it covers a lot of the things we mentioned today, and they also have a lot of educational videos. If your practice already looks after patients diagnosed with breast cancer, the University of New South Wales is currently running a trial. They are seeking expressions of interest from GPs that would like to test the Empower SMS GP program, and that sends digital advice and lifestyle support program to the patients in between their appointments. For more information or to enroll, you can scan the QR code or reach to Dr. Anna Singleton or Dr. Nasheed Hafiz. We also have a relevant upcoming event in October, which will deal with management of breast cancer. It will be advertised in the Sydney Health Weekly tomorrow, or you can head to our educational page to register. Yep. Again, if you would like help with this quality improvement activity or talk about upskilling in using your clinical audit tool or designing a breast screening project that's fit for your practice, please call or email us on these details on the screen. And now we can open up the floor for questions.
Linda, yes, we do have some question. A question for you. So Polar is only linked to our best practice database. How do we know if the patient has had a screening done elsewhere? Is there a register like there is a register for cervical and bowel cancer screening?
Ruby, would you like to answer this one?
Sure. So no, there is unfortunately no register available, which does mean, like Linda mentioned, the importance of your practice data. So it's really important to emphasise to your patients to give consent for Breast Screen New South Wales to send results to you. If you currently don't have someone's results because they might be a new patient or they might go to a couple of GP practices, you can call Breast Screen New South Wales while the patient is attending your practice and get consent for Breast Screen New South Wales to provide the most recent results to you.
Perfect. I hope that answers your question. If we have any more, please let us know. Okay, looks like that's the only one.
Okay, so if there are no more questions, maybe there is one more. Oh, okay, thank you. Okay, so if there are no more questions, we thank you for attending today's session, and please complete the online survey that will pop up in your web browser, and we look forward to seeing you online soon. Thank you.